What is stroke? Let's try to understand this. A stroke is a disruption in the brain caused by a lack of blood flow. A mini stroke or a transient ischemic attack, also known as a TIA, happens when a blood clot temporarily blocks the blood flow to the brain. So what are the most common symptoms of a stroke? Stroke is marked by an inability to speak or understand speech, a strained expression, inability to move or feel part of the body, and confusion. Someone who's having a stroke may also have trouble talking or understanding a conversation. How do these symptoms affect the different part of your body? Well, in the eyes, you can have sudden trouble seeing in one or both eyes. On your face, your arms, and your legs, you can experience numbness or sudden weakness. And you can also feel nausea. You can feel suddenly very tired without possibility to move or ask for help. Severe headaches, sudden dizziness, trouble walking, loss of balance or coordination. What are the risk factors of having a stroke? Smoking, high blood pressure, heart disease, atrial fibrillation, diabetes, abuse of drugs or alcohol, obesity, and a sedentary lifestyle. The National Stroke Association has developed an easy-to-remember strategy for recognizing stroke symptoms. If you think you or someone around you may be having a stroke, you should act fast. F-A-S-T. So, what do you do in case of a stroke? Face. Ask the person to smile. Does one side of their face droop? Arms. Ask the person to raise both arms. Does one arm fall? Speech. Ask the person to repeat a simple phrase. Is their speech slurred or strained? And time. If you observe any of these symptoms, call 911 immediately or your local services of emergency. Remember that when it comes to a stroke, every second counts. Treatment for strokes most effectively work within the first hours after the first symptoms started. Act fast, and most of all, don't wait to see if the symptoms disappear. The longer you wait to call emergency services, the higher the chance of brain damage or disability from stroke. Watch your loved one carefully while you wait for an ambulance to arrive. Though you may want to, you should not drive yourself or anyone to the hospital during a stroke. Medical attention may be needed while you're traveling to the emergency room. Instead, call 911 and wait for the paramedics to arrive. They're trained to treat and take care of people while on a rush to the hospital. It can take a lot of hard work to recover from a stroke. Rehabilitation won't reverse the brain damage, but it can help you relearn the skills you may have lost, like learning to walk or learning to talk. The time it takes you to recover depends on the severity of the stroke. Although some people may take a few months to recover, others may need therapy for years. Still, people who have had a stroke may live long and fulfilling lives if they follow through with the rehabilitation. It's important that you prevent or treat the conditions that put you at risk for stroke, such as high blood pressure, diabetes, and high cholesterol. If you would like to continue learning about stroke, please check out my next video on treatment. Thank you for watching.